House lawmakers taking a close look at concerns of state governments when it comes to the implementation of the federal health care law. This happening as we are less than 2 weeks away from the day the exchanges go live, when the uninsured will be able to shop online for health care coverage. Will they actually do it? Republican Senators Ted Cruz of Texas, Mike Lee of Utah are pushing to defund ObamaCare, but some Republicans are now taking a different approach, trying to delay instead of defund. Karl Rove is the former senior advisor and deputy chief of staff, President George W. Bush, also a Fox News contributor. What do you think of the latest strategy, delay for a year, not defund?
Yeah, I think it has a much better chance of passing. 20-some-odd Democrats in the House have already voted to delay Obamacare,
right,
based on the fact that the president, and that was before the president
Sure.
granted the year extension to businesses, said, we're not going to make you live under Obamacare for a year. You don't get stuck with penalties.
Have to.
But individuals have to, by December 31st of this year, buy insurance or start to pay a fine next year. So if you look at it, Crossroads GPS, a group I helped organize, recently did a survey in battleground Senate states and swing Republican and swing districts, and found that independent voters oppose Obamacare with 60%. But they also oppose a defunding strategy with 58%.
Which would shut down the government.
Which would shut down the government, but they support a delay strategy with 58%.
Well, what do you gain from a delay of 1 year?
You gain a chance for a continued dialogue and for all these bad things to continue to happen. We saw it with big companies. Walgreens has now announced major changes in its health insurance coverage. IBM said we're going to dump coverage for all of your for all retirees.
Right.
UPS said no longer are we going to provide coverage for spouses of UPS workers who get coverage at their own jobs. So we're going to continue to see lots of bad news. The government itself, when it passed the bill, the Congressional Budget Office estimated that 3 million people would lose their employer-provided coverage. In February of this year, they now raised that number to 8 million. The Center for Medicare and Medicaid at the Department of Health and Human Services says no, it's going to be 14 million, and other estimates are even higher. So what happens when millions of people start losing their coverage next year as their employers dump it? And then we also see how it's affecting employment with lots of more part-time jobs and not full-time jobs, because part-time workers don't get covered under Obamacare.
There is speculation that some of the White House, maybe even the president, sort of secretly hoping for a government shutdown because they're convinced that Republicans will get the big boy bad blame on this and install Nancy Pelosi once again as Speaker.
Look, it's not a secret. He's openly saying it and has been saying it for the last several months. He wants a shutdown because he understands this is one thing that could rescue him. Look, independent voters who voted 56% for Republicans in 2010 after voting for Democrats in 08 at 51% and in 06 at 57%. And what he wants to do is bring those independents back into the Democrat column. And it'd be even worse this time than in 1995, Greg, because in 95 when we had a shutdown, most of the government was funded. We passed 7 of the 13 appropriations bills, including the 2 that fund the military. So most of the government was funded. And the 21 days the government was shut down, most of the other agencies could continue to operate at reduced levels with existing monies. This time around, we'll begin the fiscal year with not a single one of the now 12 appropriations bills passed, which means the first week of October, not a single federal employee gets paid, starting with the military.
All right, let's assume the strategy moves forward with delay and not defund. What's the likelihood of that actually passing the Senate? I mean, it passed the House, probably, but in the Senate, are there enough Democrats there, and some of them are getting hammered right now by their constituents, saying this is not fair. You're giving an extension, a delay to businesses, not us.
Well, that's why it's got a good chance of passing, because the president said, if you're corporate America, I'm going to give you a pass for a year, but if you're an individual, you're stuck either having to purchase insurance or pay a fine. And so, yeah, I think, look, if you get 20-some-odd Democrats in the House voting for a delay measure before the president grants a delay to the corporations, then I think you're likely to have a much better chance of getting Democrats in the Senate. And the narrative changes. Right now the narrative is Republicans upon Republicans. They're fighting each other. You get a measure through the House with Democrats supporting it, and the narrative now is Democrats and Republicans alike think the president's making a mistake on the Affordable Care Act.
I look forward to your op-ed tomorrow in the Wall Street Journal.
Journal.
Tomorrow morning, bright and early.
Thank you, sir.
Karl Rove, as always, Karl, thanks so much.